In this video, we will explore how to accurately diagnose carpal tunnel syndrome, one of the most common compressive neuropathies. This condition arises from the compression of the median nerve within the carpal tunnel. First, the clinical examination. We begin by carefully examining the hand and wrist, looking for any signs of atrophy in the thumb area or any swelling, redness, or deformity of the wrist. We also compare both sides to identify any asymmetries or abnormalities. Second, Phalen's test. We instruct the patient to fully flex both wrists in a palmar direction, bringing the backs of the hands together, applying pressure and maintaining this position for 30 to 60 seconds. The test is considered positive if the patient experiences numbness or pain in the distribution of the median nerve, such as the thumb, index, or middle finger. Third, Tinel sign. We gently percuss along the path of the median nerve at the wrist. If the patient reports tingling, numbness, or a pins and needles sensation radiating to the fingers, this is typically indicative of nerve compression. Fourth, sensory examination, 2-point discrimination. With the patient's eyes closed, we use a special tool to measure their ability to distinguish between 2 points. We ask the patient to identify whether they perceive 1 point or 2. We then repeat the test, gradually decreasing the distance between the points until we find the smallest gap at which the patient can still differentiate them. A larger distance, especially if it exceeds 6 millimeters, suggests sensory impairment due to nerve compression. Fifth, the motor examination. We evaluate the strength of the muscles innervated by the median nerve, particularly the abductor pollicis brevis. We test the patient's ability to bring the thumb to the other fingers, and any weakness or muscle atrophy may indicate chronic or severe compression. Finally, nerve conduction studies. This is the gold standard for diagnosing this condition. These studies measure the speed of nerve signal transmission through the median nerve, allowing us to determine the degree and location of the compression and to differentiate between possible causes of the symptoms. In summary, diagnosing carpal tunnel syndrome depends on a comprehensive clinical examination supported by Phalen's and Tinel's tests, as well as sensory and motor assessments. Ultimately, nerve conduction studies confirm the diagnosis and help determine the severity of the